Good afternoon. This is the March 5th, 2020 hearing for the Health Committee. I am Councilman Christopher Burnett, Chairman of the committee. Also in attendance, we are joined by Councilmember Henry, representing the 4th District and member of the committee, Councilmember Clark, representing the 14th District and member of the committee, and Councilmember Slifer, representing the 5th District and member of the committee. We're also joined here by Matt Segman from the Mayor's Office, Kaylin Young from the Council President's Office, Dominic McAlilly from the Council President's Office, staff. And to my immediate right is Marguerite Curran, the committee staff person. We're meeting today to discuss the Council Resolution 20-0194R, Informational Hearing, Baltimore's Strategic Response to the Wuhan Coronavirus. The purpose of this is to invite various city agencies to brief the City Council on Baltimore's strategic response to the Wuhan coronavirus. When the Council President arrives, we will defer to him. He was the one that introduced the resolution. And I want to first acknowledge the hard work that MOEM, the Health Department, and all the agencies participating today have done thus far and will continue to do until the job is done. We commend your work and dedication. We're here today to not scare the public. I want to be clear about that. But we are here to understand the city's readiness to respond to an infectious disease that may already be within our borders. At the same time, we know that influenza, which is also a virus infecting an average of 30 million Americans annually, and that by the end of the flu season can see upwards of 60,000 deaths in a given year, and we are nowhere near those numbers either in this country or globally, so we should have levity as we discuss this disease and its potential spread. We should be remiss if we didn't talk about preparedness and response, because if this does become a big problem, our efforts must reflect this. So we're also here to dispel myths and rumors. We want to make sure that accurate information is being put out to the public. So thank you to the media for showing up to help us get accurate information out. We do not want to create any fear. We just want to make sure that the citizens know that the amazing workers that we have in Baltimore City government are working hard to protect us all. With that, I do want to give the President an opportunity to welcome us as well before we get going.
Thank you everybody for being here. I think the chairman already hinted to what we're here for tonight. This is simply about making sure and ensuring that we are prepared as we possibly can be for something very seriously. We know that we have an excellent Baltimore City Health Department, but also about making sure that we get as much information out to the public as we can, so as we start to deal with this endeavor, to make sure that we're communicating in the way that we need to make sure that Baltimore City residents and those who visit and work in the city of Baltimore can be as safe as possible, as we know this is something that is very dangerous. We do not, again, want to spread fear or pandemonium, but we do want people to be educated and prepared to deal with this very serious situation. So we look forward to hearing from everyone. Thank you, Mr. Chair.
Thank you, Mr. President. So we have a few presentations, and we are going to start with the Baltimore City Health Department. The floor is yours.
Thank you, Chair Burnett, Council President Scott, fellow committee members. My name is Leticia Jarasa. I'm the Commissioner of Health for Baltimore City, and I'm also a pediatrician. Today, I will be providing information around the novel coronavirus, also referred to as COVID-19. I'll be talking about general data, as Chair Burnett mentioned. A lot of what we're hoping to do today is dispel myths and provide accurate information, as well as what the response has been from the Health Department so far. Before we delve into the presentation, I do want to state that the situation is rapidly evolving. We rely on information from the Centers for Disease Control and Prevention, and they are changing their guidance very regularly. We refer to it often, and so the information that's going to be presented today will be up to date as of this morning. So I'll be talking about what COVID-19 is. I'll be talking about how it's spread. I'll also talk about some of the clinical characteristics of COVID-19, how we might know if someone has it, how we treat and prevent COVID-19, questions like who needs a mask, the current situation, as well as our response so far, additional actions, and how COVID-19 could potentially affect Baltimore City, as well as other common questions and next steps. So I will again use probably novel coronavirus and COVID-19 interchangeably. It is a respiratory illness that can spread from person to person, and the virus that is causing the disease has also been called SARS-CoV-2. Symptoms include fever, cough, and shortness of breath. It was first identified in December of 2019 in the Wuhan, Hubei province of China. Since that time, we have seen cases from person to person, so there has been person-to-person transmission, and it is now spread far beyond China with over 90,000 cases worldwide and 3,000 deaths so far. Looking more closely at the numbers identified in the United States, there have been 47 identified cases, and again, this information is up to date as of this morning from the Center for Disease Control website, and again, this is national information, and an additional 49 persons were identified that were being repatriated to the U.S. When we look at Maryland's numbers, again, this is accurate to 11 a.m. this morning. There have been 31 cases that have been tested for COVID-19. Of those, 14 have been negative and 17 are still pending. To date, as of this morning, there are no lab-confirmed COVID-19 cases in the state of Maryland. Again, coronavirus is actually a family of viruses that cause ranges of symptoms. So it may cause symptoms as mild as the common cold, cough, runny nose, fever, and we, in some cases, see more severe disease, as was the case in SARS and in MERS, and we are seeing more severe disease in some cases with the 2019 novel coronavirus. So at this point, it's unclear how easily it's spread. A lot of the information that we know about spread is based on what the cases we've seen in China and what we know of similar coronaviruses, so viruses within the same family. We do believe that there, again, is person-to-person contact. If you're within close contact of someone, we believe it's spread via respiratory droplets, so coughing or sneezing from an infected person. There is possible spread by touching surfaces or objects with the virus on it, but we don't believe that this is the main way that COVID is spread. Speaking of clinical characteristics, so the incubation period, which is the time between initial infection and when symptoms begin to develop, is thought to be around 5 days, but can range anywhere from 2 to 14 days. So that isolation for 14 days, that is where the number comes from. Again, this information is still rapidly evolving, so could potentially change. Symptoms include fever, cough, and shortness of breath. In more severe cases, we do see pneumonia, but you can also see cases or symptoms that are similar to the flu, like sore throat, headache, diarrhea, and nausea. Again, we've noted thus far that it seems like symptoms are worsening about a week in, and asymptomatic infection, meaning having novel coronavirus without symptoms, has been described in a minimal number of patients. So again, risk factors are unclear. We do believe that older adults may be more susceptible to more severe disease, and those with underlying medical conditions. So most reported cases that have been documented have been within adults. About a third to a half of those have some underlying medical condition. The range of severity, there is a range, so it can range from being asymptomatic to mild disease to severe illness. About 80% of cases are noted to be within that mild disease range. It's unclear how many people who are actually exposed will go on to be infected, and it's unclear of those that are infected how many will require hospitalization. So certainly those that are hospitalized are the ones with more severe disease, and so about 20 to 30% of those do require ICU care. When we think about mortality rate, which I know is being reported a lot in the news, it is thought to be somewhere between 2 and 3% overall. This includes those milder cases that we're talking about. So how do we know if someone has COVID-19? There is lab testing available, and it was recently made available to the Maryland Department of Health as well. So their public health laboratory will be performing lab testing as of this past week. Healthcare providers can call the health department if they are concerned about a potential patient who needs to be put under investigation. They can also collect the samples that are required for testing. In Maryland, cases and persons under investigation are reported and updated regularly on Maryland Department of Health's website. So there is currently no cure to COVID-19. Currently, what we recommend is supportive care. So similar to how we might manage the flu, supplemental oxygen for someone who has low oxygen saturation or difficulty breathing, rehydration, so making sure that people stay hydrated, blood pressure control for anyone who may be experiencing low blood pressure as a result of COVID-19, and general pain and symptom control. So how do we prevent COVID-19? Again, at this time, there is no vaccine. I'm going to talk a lot more about some of those personal protective factors, but again, avoiding close contact with someone who's sick, avoiding touching your eyes, nose, and mouth, staying home when you're ill, covering your cough or your sneeze with a tissue, throwing that tissue away, and then washing your hands. Washing your hands with warm soap and water for at least 20 seconds, or in the absence of access to soap and water, utilizing alcohol-based hand sanitizer that's at least 60% alcohol, and cleaning frequently touched surfaces using household cleaners. As far as who needs a mask, at this point, the CDC does not currently recommend a mask for people who are well and to protect themselves from any respiratory diseases. Masks should really be reserved for those who are showing symptoms of COVID-19 to help prevent the spread to others. For example, we think about our healthcare workers often who would be in close contact or taking care of someone with COVID-19. The healthcare worker would need a mask if there is a concern. And again, those who have COVID-19 or are suspected to have COVID-19 would wear a mask to prevent that additional spread. So just a very high-level timeline. The first cases were detected in China in December. By January, the virus was detected via lab. The first case was detected in the U.S. on January 21st. We saw the World Health Organization declared a public health emergency on January 30th, with subsequent declaration by the U.S. As well on January 31st. We began to limit entry of travelers from China into the U.S. In early February, Maryland Department of Health also started to screen travelers coming from China to Maryland. Subsequently, we noted community spread on February 23rd, mostly on the West Coast in California, Oregon, and Washington State. On February 28th, the CDC issued updated travel advisories to countries that were considered very high risk based on the number of cases that they had, and the first death in the U.S. was reported on February 29th. So current situation, I've talked about this a little bit. We are seeing community spread in the U.S., which does raise the level of concern. There is a potential public health threat that we note to be high. However, most people in the general public have little immediate risk. This will likely cause a pandemic throughout the U.S., and we'll see some widespread transmission across the country. Again, as far as our general response, non-medical interventions right now are what we're recommending without a vaccine. Again, personally, staying home if you're ill, hand washing, covering your cough and your sneeze. From a community perspective, if the time becomes necessary, social distancing, closing schools, limiting mass gatherings, environmentally cleaning frequently touched surfaces. Again, these non-medical interventions, which I'll go into even more detail, are referred as community mitigation strategies, and that is a large part of what we're recommending. With regards to travel screening, the CDC initially released guidance on February 3rd. So right now, the Maryland Department of Health receives a list of travelers from China and performs a risk assessment based on where they traveled from, as well as any potential contacts that may have been confirmed cases. The Maryland Department of Health monitors those residents for symptoms. Low-risk individuals have no restrictions and are asked to self-monitor for symptoms, but this guidance, again, could change. Our response actions thus far, weeks ago, we actually activated our incident command structure. We're at a level 2 currently. We support Maryland Department of Health in surveillance to detect and monitor cases. So we have support staff available 24/7 to respond to calls if there is a concern about a person that needs to be placed under investigation. We coordinate with our local healthcare providers to test those patients, and we perform that contact investigation. The Maryland Department of Health and the CDC are also, again, helping to support our coordination on surveillance and testing. Additionally, we coordinate with state and city partners. So we've been working closely with fire as well as the Mayor's Office of Emergency Management on a 911 protocol. We also have sent COVID fact sheets out to Baltimore City school students and families. We provide guidance to local universities as well as other businesses and healthcare providers on just general pandemic and continuity of operations planning. We support and work closely with coordinating with our city hospitals. So we have regular calls with city hospitals, regular calls with Maryland Department of Health, and regular calls with the Centers for Disease Control and Prevention. We held our initial press conference on February 5th to discuss our initial planning, and subsequently held another press conference this week to discuss where we were in planning currently. We've briefed the mayor's cabinet on our efforts thus far and are working closely with them as they begin to update their COOP plans. We launched COVID-19 website as well as released social media messaging and have provided prevention tips to all city employees. Again, I mentioned a little bit about our regular coordination and calls with our local public health partners. Some future actions include developing COVID-19 informational presentations for community groups, as well as preparedness webinars for private sectors regarding continuity planning. As we start to think about how COVID-19 could potentially affect Baltimore, there could be a potential disruption to daily activity depending on how widespread transmission is. Again, this would include things like considering a school closure, considering how we might plan or cancel large or mass gatherings. Healthcare settings are starting to inventory and understand what their surge capacity and ability to see a large number of patients would be. Also thinking through for businesses how they would plan for potential absences, how would they continue their operations. Some other common questions, certainly around school closings. Again, we've been in frequent conversation with city schools, helping to provide guidance as they update their emergency operations plan, and it will be on a case-by-case basis. The decision will be made in conjunction with the Maryland Department of Health, as well as MSDE and city schools. Some instances where you might consider school closures certainly would be if there was a high absenteeism rate for students as well as teachers, if there was a need for outbreak control and isolation, or extensive cleaning. So another question is, what if employees have traveled to a country with ongoing transmission? So I can't stress enough the importance of, if someone is ill, encouraging them to stay home, providing flexible sick leave policies and not stigmatizing someone who may not be well. So again, not requiring a physician note if someone has to take sick leave, knowing that healthcare providers may be overwhelmed during this time. In part, it really depends also on the type of employer. Can telework be supported? Starting to think through what those policies should look like. So again, if visiting a country with transmission, encouraging that person to have self-monitoring for symptoms. Additional CDC guidance is forthcoming, and this also may change. So some specific advice for parents. So again, there's no evidence at this time that children are more susceptible than adults. There's very limited reports suggesting very mild symptoms in children. But again, this could be evolving and this could change. We encourage the usual prevention actions of keeping a sick child at home, encouraging hand washing as well as using hand sanitizer, avoiding other children who are sick, and wiping down frequently touched surfaces. So what to expect? We alluded to some of this, that we do anticipate that there will be more cases nationwide. As the CDC updates and changes its guidance on who is considered a person under investigation, we will see additional testing. So we will see those numbers go up across the country as far as the number of persons under investigation. We are seeing active community transition, again, largely on the West Coast that's been seen. There may be possible outbreaks in healthcare settings. And again, I think we can rely on some changes to that CDC guidance. So as far as next step, the health department is looking to coordinate all city agency PIOs around general messaging. So us serving as that initial point of contact if there are media inquiries or questions, and then organizing and coordinating with other city PIOs to make sure that the messaging is uniform and accurate, as well as ensuring and supporting other agencies to ensure that COOP plans have been finalized for each agency, working again with the Mayor's Office of Emergency Management, DHR, and the Office of the Labor Commissioner to update any work policies around telework and flexibility for residents who get ill or have to take care of ill family members, and again, working internally just to finalize some prevention signage that we've already worked on that we want to get out that encourages some of the protective measures that I'll talk about in a moment. Again, just ramping up our public information and messaging. We really appreciate this opportunity to talk about the work that we're doing and what residents can do to protect themselves, working with partners and local businesses, as well as other external organizations to make sure that they are prepared. I mentioned the webinars that we'll be hosting. Those will be available to those local business partners so that they can ensure preparedness, and then planning for just more community-wide mitigation strategies, and then continuing to work with healthcare facilities, continuing to work with Maryland Department of Health and CDC on providing guidance and support for our local healthcare facilities. So how do we prevent that widespread cases? So, a big part of that is identifying potential cases very quickly to prevent that community transmission. And we have staff that supports in doing that. Implementing the community mitigation strategies, as the situation evolves. We know there's not necessarily a vaccine at this time, so we want to work on slowing the spread of illness and directing resources to where they're most needed. So as we think about community mitigation strategies, I've talked about a lot of the personal protective behaviors. Again, I want to stress it. Washing our hands with warm soap and water for at least 20 seconds. If warm soap and water is unavailable, using alcohol-based hand sanitizer that's at least 60% alcohol to wash our hands, coughing and sneezing in a tissue, throwing that tissue away, and then washing our hands, not touching our eyes, our nose, and our mouth, and staying home if you're ill. And then isolation, again, staying home if you're ill, limiting close contact with others in cases of illness. As we think on a broader scale at the community level, again, on a case-by-case basis, we'll have to look at what it would look like to potentially close schools or other entities and what we should plan for in terms of mass gatherings. Additionally, making work policies flexible so that folks can telework or have some type of flexible leave. So here's a list of our resources. We have a webpage that's up here. Maryland Department of Health also, again, that is tracking the persons under investigation across the state regularly on their website, and the Centers for Disease Control. I think I want to stress that I think we all have a part to play in just sharing this information around personal protective behaviors and what we all can do to prevent the spread of all illnesses. And I also want to highlight that we are still in the midst of flu season. So I would still strongly encourage folks who have not received a flu shot to get one. Chair Burnett mentioned just the fatality rate in the U.S. alone is still very, very significant, and the amount of folks who get flu annually is still very significant. So we should be thinking about this as measures to protect ourselves and people we love from a novel coronavirus as well as from the flu. Thank you.
Okay, thank you. So we'll start with President Scott. Questions?
Thank you, Madam Commissioner. It's very great and actually very reassuring that you guys are doing great work, as you always are. Just want to talk about that coordination and how we can be helpful to get that information out, and because they're here today, about how we can use our partners in the media to do that as well. For example, I know we'll do it, make sure we work with you guys to embed either this PowerPoint or whatever you want us to do on the council's website, but have we thought about doing that as soon as you go to baltimorecity.gov as well, and then making sure that we're all communicating, everyone that's in this building and city government are communicating the same messages via social media, et cetera, following the lead of the health department as the professionals of this on the situation.
Yeah, no, I think we would definitely appreciate embedding information and fact sheets that we come up with on the City Council's website. I know a lot of times City Council, you may repost things that we're posting on our social media website, so we are, posting different messages around prevention. So absolutely, reposting those things. Would be happy to kind of connect the City Council liaison with our PIO to discuss strategies for how we can disseminate the message even further.
I think we know that guy just a tad bit here at the City Council. And then to take that a step further, just a quick question. Are you okay with us sharing this PowerPoint with the total public? Like we can just put this on?
Yes, again, the caveat being that information is subject to change. So we have that disclaimer.
When you tell us it's a new one,
yeah.
we'll take it down.
Yeah.
And then just asking our friends in the media to share the same kind of information.
Yeah.
Also, you talked about the communication with like the schools, the hospitals, and I know that we're doing it with our own senior buildings that the city runs and operates. But what about those that are privately operated? Have we started to do that outreach as well? Because they're just as vulnerable. We have to get the information to them too.
And you're saying our senior centers?
Yeah, not the one. Yeah, senior buildings that the city doesn't run, right? Like there's some that are run by the city clearly, but there's a lot of private facilities too. And if we can figure out a way, if we haven't already, how to get that information out to the management and the residents that live in those buildings.
Mm-hmm. So we would coordinate with them similar to how we would coordinate with the senior centers that are run by the city, ensuring that they get the appropriate information. Same thing goes, the Maryland Department of Health is working on communicating with our support to long-term care facilities that are located in our region. And likewise, we're looking to inventory all the assisted living facilities in the region as well to ensure that they get the same message. So really coordinating very closely with Maryland Department of Health for like the long-term care and assisted living facilities. And again, for the senior centers, we would communicate the same message.
Yeah, I don't think that they're here, but I know that housing and maybe OEM would have that complete list from previous incidents that they could share that with you so that we could get the information. I know housing has it for sure, so that we can get that information out. And then also, when you talked about communicating with the hospitals, like I understand that some folks at Hopkins are some of the leading people on this, and having them be in Baltimore is important too. Can you, in much detail as you can, talk about how that relationship is going to continue, but also expand as we go through this crisis?
Yeah, so absolutely. We see Hopkins as well as our other local institutions as wonderful resources. We have been in contact with specifically the emergency preparedness teams and infection control teams of our local hospitals, but have had conversations with the CEO of Hopkins as well as other staff in their School of Public Health, and they've have been very forthcoming about any additional information that they want from us. So I think the conversation will continue, but we're already speaking with them pretty regularly, again, with the state's input as kind of the lead state agency supporting the efforts.
Thank you. And my last question for now, Mr. Chair, is really not for you, Dr. Duran. It's really for the administration to talk about how we are sharing the information that the health department is giving to our other agencies within the agency, especially for those who are doing emergency service, police, fire, folks like that, and how the information is getting out to those who are going to be interacting with the public in ways that no one else will, or how we're making sure and ensuring that they're getting the information and protecting themselves as much as possible.
Do I have to introduce myself?
Just introduce yourself.
Yeah, just
Okay. Sunny Schnitzer, Deputy Chief of Staff for Public Safety for Mayor Young. So I would kind of reiterate that as the health commissioner mentioned, we've been regularly communicating with cabinet members, including disseminating the information of the health department, sending updates. So as we get updated information, making sure that gets out to each of those agencies. We also know that all of our agencies are actively working to gather kind of agency or issue areas guidance. So for example, there's guidance coming from the CDC on law enforcement operations. So each of those agencies are responsible for carrying that out. In addition, we are working on tabletop exercises to make sure that we are fully prepared. We are continuing to kind of send out updates. I believe there's also work being done with MEMA to translate all of the materials being created by the health department. And in terms of kind of getting the information to the line worker, I would kind of defer to the individual agencies on exactly how they're carrying that out. But what I would say is, that Mayor Young has asked that each of the agencies update their COOP plans. They've been given guidance on that, and as a part of that, they've been asked to also report back on certain preparedness measures as well.
I know that they're here. Can police and fire talk about how they're doing that right now?
We have them do it.
I'm sorry. Sorry about that.
He's already up.
Mr. Deputy, come on.
Certainly. Good evening, Mr. President. Is that better?
Mics are old in here, Deputy.
So, like has been spoken here earlier, we're taking guidance from our partners at the Health Department and the CDC, and making sure that we're communicating with our members. We've used various methods to do that. We've pushed out through our accountability tools that we have, so we know that each member is actually getting it. We're sharing it at roll calls. We've also shared it with the FOP membership and asked that they push it out through their channels, so it's touching everybody in every way possible, and making sure that it gets out.
Thank you.
Did you want us to do the full presentation for fire, or just answer the
Just
question?
answer that question, sir. Thank you. Just that one.
So, in interest of transparency,
And identify yourself.
sure. In the interest of transparency, we put at least weekly updates out to our members.
You have to identify yourself first.
I'm sorry. My name is James Matz. I'm the acting deputy chief of EMS for the fire department. In the interest of transparency, we frequently put updates out to our members with the latest information that comes out from the CDC, the Maryland Department of Health, as well as the local health department. Sometimes those come out more frequently than not, because it can be as simple as the initial 911 questioning was anybody that's traveled the last 14 days to China. Then like a day later, it changed to 5 additional countries. Initially, our transports, we could only take persons to Johns Hopkins. It just recently changed to all appropriate hospitals. So in the interest of transparency, we're putting these out as frequently as they're coming to our members and keeping them up to date.
Thank you.
Sir.
Okay. So I had a series of questions, but I think Councilwoman Clark had one for the Health Commission.
Yeah, I did. Thank you.
Yeah.
I have 2 questions right now. So in coordinating with all the different agencies and the unions representing them, et cetera, what you're recommending is sick leave days without the usual process. Is that all been worked out through Human Resources here in Baltimore City?
So I don't know if we have a rep from, I know from DHR here, but I know David from Mayor's
I
office
just
is-
yes or no, and then they probably
So,
make a presentation.
David McMillan, Director for Mayor's Office of Emergency Management. So we've been in contact with the label commissioner as well as the head of DHR. We're working through the policies and processes that were previously drafted to be in place for H1N1, and making sure that they're appropriate for COVID-19. We have ongoing meetings on that, and we should have guidance for that pushed out hopefully by next week.
Great. Second question is this. I went around and visited and talked with the people in my senior citizen buildings about a week ago, I guess now, just to see what's going on and what they need or what they're thinking. And here's the question that I came up with, and you might not have an answer yet, but I guess we should. Sometimes, if there is any kind of, if this comes to us, which it has not yet, but if it did, I think our senior citizens, especially those in congregate housing, will not want to go out. I think they might, not because they're asked not to go out, but that they are afraid to go out and catch something. And that means they're not going to go as much to grocery stores as they need to eat. And I'm wondering if we have any provisions to meet the need of, even if it's not a bad outbreak, but senior citizens are going to be the most careful of all. Our children, the daycare centers would close if told to do so. Schools would do likewise. But these are seniors who live there in congregate housing. How are they going to get food if they decide that they don't want to wander out into crowds of people at a grocery store? Is there any provision like from Meals on Wheels? I know that in a couple of my high-rises, they indicate they might be able to cover the whole buildings if they needed to, but that's just talking to me, not officially to the city.
Yeah, so one thing I will say is we do currently have a contract with Meals on Wheels for seniors that are homebound. We are already beginning to think about what you mentioned, which is essentially food access, and we're thinking about it across the entire population, so including older adults as well as children. Again, in the instance that schools may close, we have children who receive 2 meals a day
Right,
at
exactly.
school. So we are already working with the Department of Planning as well as other pertinent agencies to make sure that we develop a plan for what it would look like if there was a pandemic and there was a need to distribute food to all residents who struggle with food access.
Correct. I see that your chief of senior citizens is standing in the background. You have a great staff, good leadership there.
I was going to say Dr. Girassa really answered the question. We have a home delivered meal program, and the best answer and easiest answer right now is if older adults require home delivered meals, please call 410-396-CARE. It's our Maryland access point. It is available 24 hours, and after hours, it's being picked up by United Way 201.
Well, I guess the question, though, is, yeah, you can call that number today, and everything will go along. But if you have hundreds and hundreds of people, well, actually, it shouldn't work that way. Somehow, within a building, management should be able, I don't know. Somehow, you shouldn't have hundreds of people per building calling Meals on Wheels or such service. So I guess I'm not asking for an answer.
Okay.
I'm just saying, think of a situation in which everybody gets the same idea at the same time.
So 5 years ago, the Department of Planning led a plan to develop mass food distribution in the event that this will occur. We're having a collaborative interagency meeting, I believe tomorrow, to discuss and review policies and plans for mass distribution if that is required.
Right, thank you. I think it's very important because that's a lot of people and they're all vulnerable. Thank you.
Thank you. So, Dr. Sarazis, we know that Baltimore has a high percentage of older adults, people with underlying illnesses. Can you speak to asthma and whatnot, COPD, hypertension, diabetes, et cetera? Can you speak to how the collective work being done is targeting these particular groups to ensure that they are, one, being monitored closely, two, we know that they're susceptible, so what additional measures are being taken knowing that we do have high concentrations of individuals who may be immunocompromised in some way?
Yeah, so I think the personal protective measures they stand just across the board. So for those with underlying medical conditions, certainly recognizing that we may have a higher risk and more vulnerable population in the city. I think we again have been in contact with local healthcare providers and hospitals to ensure that that they feel equipped were there to be more of a surge in individuals with greater health challenges. But I think the messaging we want to be consistent for everyone to protect all of us is really that personal protective measures that I discussed.
Okay. And the same for, I guess it would be the same for children as well, young adults. Is there communication going out to daycare centers and that kind of thing, where large numbers of young people are gathering?
So we've worked closely with schools. We have not had that communication with daycare centers yet. The CDC's guidance thus far actually has been limited from K to 12, though we presume that a lot of the same measures would be taken for a daycare setting. So we would work, MSDE and MDH would kind of help with that messaging. So we have not yet put that out there.
Okay. And last question, I know that the president has a follow-up on that. So there's been a lot of communication in the media and through a number of channels around equipment such as masks, but I also recall reading concerns about respirators and other medical equipment. Mm-hmm. Can you speak to what you're hearing from the health departments, sorry, it's been a long day, from hospitals about their equipment? Do they have enough to handle large incidences? Mm-hmm. And I guess the other question would be, are we in communication with finance around, if there are needs for additional procurements of equipment, that kind of thing? Are we prepared for that?
Yes, I'll speak generally, and then I'll bring up actually my Deputy Commissioner of Population Health. So again, hospitals have been doing kind of ongoing inventory, just as we do our own internal inventory. So they would be responsible kind of for their stock, but those conversations are already starting to take place. So we know that hospitals are beginning to prepare.
Good evening, Jennifer Martin, Deputy Commissioner for Population Health and Disease Prevention at the Health Department. So as Dr. Gerasa mentioned, our hospitals are working to keep stock of their inventories and have been reporting that out to the State Health Department, who's been coordinating that on behalf of the state of Maryland. Currently, we had a call earlier this week with our hospitals, and we did discuss PPE and PPE needs. And at this time, our city hospitals have reported to us that they are able to continue to get masks that they need through their vendors, although on what is referred to as an allocation basis, meaning that their orders are being filled based off historical data of their needs. But currently, at this time, they are able to purchase masks.
Okay.
Sorry. Follow up?
Thank you. Madam Commissioner, just a follow-up to the councilman's line of questioning. Thinking about also another population in the city that we know could have compromised immune system. How are we communicating with the folks that are dealing with folks that we know are struggling with addiction in those centers and the people that work with those individuals as well? And then also, when we're talking about your communication with Rec and Parks, that I know you are we ensuring, or maybe, Madam Deputy, this is for you, are we ensuring that like Recreation Parks is actually sharing that information and sending it home with children and parents so that they're informed as well? So that, you know, I want it to be that parents are saying, like, you guys sent this home with the kid from school, why are you doing it from the rec center too? As much as we can get that information out to people to make sure that they're spreading it.
Yeah. So with regards to residents with substance use disorder, I communicate very regularly with the CEO of Behavioral Health System Baltimore, so supporting them with development of, again, messaging to address that population. We've been able to support them, and they know that we're available for resources needed.
Sure. So I would just, I want to be a little cautious because the Parks Department is not directly in my portfolio. I know that they're actively disseminating information. I'm not sure the exact policies in place, so we'll get back to the committee on that if that's okay.
Yep, thank you.
So the other thing that we've heard a lot about is the isolation and quarantine, both from a policy perspective and best practices. Can you speak to planning around, and I don't know if this is more appropriate for the health department or OEM or maybe both, but if you could speak to sort of what that looks like and what best practices are and what the plans are for that.
Sure. So I'll speak generally and then see if my Deputy Commissioner has anything additional to add. So decisions to quarantine would really be made on a case-by-case basis in conjunction with the Maryland Department of Health based on CDC guidelines. So it's not a decision that would be made lightly, but we would have to consider each case individually.
Yeah, so as Dr. Gerasa mentioned, decisions around quarantine of individuals are being done on a case-by-case basis currently, and we do work in conjunction with the State Health Department as well as with the CDC to make those determinations. Currently, again, we have no confirmed cases in Maryland, so there are no individuals being quarantined in Maryland currently, but that is how those decisions will be made.
Council President Scott, and then Councilman Henry?
I'm actually asking the question on. Oh yeah, you're still good. Go ahead, Councilman.
Yeah. So I'm sorry. I had asked the council president to ask this question for me if I had already left by the time I got a chance. I don't know if this is really more for OEM than for you, but we got an email the other day that said that the threat level had been raised to level 3, and I thought it might be helpful if someone could walk us through what the different threat levels are.
Sure, certainly. So our steady state, according to the emergency operations plan, is level 4. day-to-day operations, which means everything is blue skies. A level
Mr.
3.
McMillan, you have to say who you are, sir.
Sorry. David McMillan, Director for the Mayor's Office of Emergency Management. So level 4 is our steady state, which, again, blue skies. Level 3 is watch level, which is a situation that requires ongoing coordination that can be done remotely or on scene at an incident command or emergency operations center, but ongoing coordination and monitoring. We get to level 2, that's a partial activation. That's where we request the appropriate agencies, but not all city agencies, to have representatives at the Emergency Operations Center to look at unmet needs, work through policies and procedures, and ensure continuity of operations. And then level 1 is a full activation, where we'd have a representative from every single city agency going through monitoring leading indicators on what's happening with the incident. In this case, we'd be looking at the amount of people that have illness, or internally looking at COOP, leave activation levels, and all those things.
Thank you very much.
Thank you. Okay. Okay, sorry. Just trying to find I got a long list here. Can you describe the epidemiological and tracking plan for potentially exposed individuals?
So you mean persons under investigation, how we do the close contacts? Yep. So again, I'll let Deputy Commissioner talk a little bit more about the details, but I will say broadly, it is, we're looking to the CDC for guidance on how we place someone under investigation, but she can talk a little bit more to how we investigate the close contacts.
So we would plan to do our contact investigations very similar to how we do contact investigations normally for communicable disease. Once we have coordinated with a healthcare provider and the state and an individual has been tested, and we know that they come back positively testing for COVID, we will be reaching out to what are referred to as close contacts of that individual. So individuals that, individuals that the person has been in contact with, whether it's their family members or other people at work or other places, and then reaching out to those individuals and building a list of individuals that person has been in contact with, and reaching out to them and to determining exactly what kind of contact they've had, and identifying whether there are individuals who maybe have been exposed, and therefore asking them potentially to stay home. Again, following sort of those protective measures that Dr. Gerasa has mentioned. We want individuals to stay home if they have been exposed, so that we can slow and prevent the spread of this illness. So that generally is how we would be responding and doing our contact investigation. But I'm wondering if I misinterpreted the question.
No. Can I sort of follow up? Mm-hmm. No. So basically, where do you go? How do you get tested? How do you know the result of your test? And then you know you should go home and wait and pray. But right now, right from the start, okay, so let's say I think I might be sick and maybe I have this thing. What do I do? Who do I call to get tested?
Great question.
Yeah,
so individuals,
it's a big one.
Individuals who are experiencing symptoms should be contacting their healthcare provider. I believe Dr. Gerasa mentioned that in her presentation
But that's like that's an emergency room half the time. So in other words, they need to go to an emergency room.
So individuals should contact their regular healthcare provider, understanding that there are some individuals who do not have a regular healthcare provider.
And alas, yes. So let's say, I have a doctor. I call that doctor. Does he have a test kit? Does he have a way to test me? Do I know that? Does he have one now?
So currently testing is being done through hospitals.
Okay, I will go to the emergency room.
But individuals should not their first step should not be to go to a hospital. Their first step should be to contact their healthcare provider to discuss their specific situation, their symptoms, because we do not want individuals rushing to the EDs, because there are, again, in Maryland currently, we do not have any cases, and the risk is low. But individuals should contact their healthcare provider if they have questions.
Okay, that's when I get called and asked, I'll say, please contact your health provider. Okay, so is that who's going to test them to see whether they may have this virus? Is that really who they need? Because nobody knows how to cure this. So isn't it best to figure out if you might be infected, and then I think we know what will happen then. You should go home and don't go out and infect other people. It's just a practical thing. We're talking right now, no one's affected in Baltimore. God bless us, really. And maybe we'll be passed over.
Yeah, I think, the advantage to calling the local health provider, to reiterate what Deputy Commissioner said, is we don't want to overwhelm the emergency departments with people who may otherwise be well, certainly understanding that this is a very real concern that someone may have. But I think a healthcare provider can help talk through what those symptoms might be and help them delineate, is this something that they are at risk for and subsequently require testing, or is it something that they don't meet the criteria as the CDC states it and don't require testing.
So basically, this is going to be a phone conversation with a doctor?
Ideally. So healthcare providers have after-hours lines where it's a physician, it may be a nurse, it may be a nurse practitioner, that again can ask them the questions to get to whether or not they have symptoms that would require
So they don't need to be tested. They just need to talk to somebody on the phone.
I think they need to talk to a healthcare provider who can help make that decision.
And then the decision is made what? That they should be tested?
Depending on what the nature of their symptoms are as they describe them, as well as travel history.
Or they should not worry, no problem, or maybe they should be tested.
It depends on what their symptoms are. Depends on what their symptoms are, how they're describing them, if they have a recent travel history, and if they're meeting the guidance per the Centers for Disease Control. That healthcare provider can help navigate them to the right place for additional testing if necessary.
So the doctor again, or the nurse practitioner.
Sure. Yes. Uh-huh.
So these are all done with phone calls to people on recorders, but they'll answer their phone, or they'll call back.
Yes.
And then they will talk about how you feel, and they will decide if you should get tested?
Yes, based on the symptoms that you're describing, based on a travel history in accordance with the CDC's guidelines.
And where would they then go to get tested?
At this point, a healthcare provider would direct them to an emergency department.
So it will be an emergency room in some hospital?
Yes.
And do they have the equipment now just in case we ever need it?
The Maryland Department of Health is now running tests locally at their public health laboratory. Previously, it was done at the CDC only, but it has now been rolled out to states, and Maryland is one of them.
And where is this testing being done, please?
The Maryland Department of Health, their public health laboratory.
And where's that?
It's in the city.
Okay.
Yeah.
Thank you.
By Hopkins. They wouldn't show up there, but that's where it's located.
We want people to show up there, Councilwoman.
No, I'm not asking anyone to do anything right now. I know how constituent work works.
Sure.
And when there's hundreds and hundreds of people needing the same answers,
yes,
I want to know that you're
and one of the things that we
size up this advice to many, many, many people, at least calling.
Well, one of our follow-up items, we will be providing the City Council with kind of a fact sheet for these types of questions. So we will be providing that as a follow-up kind of action item following this.
Thank you very much.
I also just really quickly mention, so currently hospitals are doing the testing. However, there are plans to roll out testing to other laboratories. And so then your regular primary health care provider would be able to collect those samples and would be able to send them to a private commercial lab. So the testing will be expanding in the near future outside of just hospitals being able to do it.
And you will let us know when that happens?
We can, yes.
Well, would you?
Yes, we can.
Thank you.
Okay. And Councilmember, I would want to note that the intention is not to conclude this hearing and not revisit it. We're going to continue to have this committee receive updates. So that's something I talked about with the Health Department staff prior to the beginning of the hearing, that we were recess this hearing, figure out what is an appropriate cycle to provide updates to both the committee and the public, and continue to do that over the next few months.
Thank you very much.
Thank you.
Dr. Sarasas, what efforts are being made to ensure that all hospitals, including non-trauma centers, are being prepared for potential outbreaks? And are there, and I guess speak to training for staff, for infectious disease trainings, refreshers for staff at hospitals, clinics, doctors' offices. Can you just speak? You mentioned that there's some coordination happening at the state level. Can you talk to
Yeah,
us
so
about that?
so hospitals typically house an infection control unit as well as an emergency preparedness unit. So on those kind of coordinating calls, those are it's those leads that are helping to kind of talk through those practices at each hospital. Typically, again, hospitals will have kind of ongoing refreshers and trainings on, for instance, as well as N95 fittings for their staff. I'm not sure if that answers your question.
No, it does. Have you? And is that training also going on within the health department? Have your staff been trained to become volunteers at clinics? If there's a need to fill in, do mass vaccinations or emergency operation centers, are health department staff being trained to fill in those roles?
Yes, so I will bring up Deputy Commissioner to talk a bit further, but I will speak, I guess, broadly about immunization. So we currently run immunizations clinic, and as was the case with the measles cases we had almost a year ago, we do have the capacity if we needed to do some mass vaccinations. We've done it before, and we would set up something similar if we got to that point.
So I'm happy to provide additional information. As Dr. Gerasa mentioned, we do a lot of planning around distribution of medication and providing mass vaccinations if needed in public health emergencies. It's planning that we've been doing for several years now, over a decade, and we have really strong plans in place, and we have exercised them, even within the last year. And we have worked very hard over the last decade on building capacity internally to be able to provide those types of services.
Last two. Is there a census count or a count of available isolation or medical surge beds in hospitals? And then sort of a larger perspective, has the department developed a surge capacity plan in case there is an outbreak in the region, and identified buildings and other surplus properties that could be used for emergency medical care?
So Maryland Department of Health is actually working with MIM, so again at the state level, to determine capacity, and they're asking hospitals to provide those updates regularly. So beginning tomorrow, hospitals will be reporting out daily on their bed count and status. So that information, we'll have access to that information. And then your second question was around identifying buildings. Mm-hmm. Is that correct? Okay, so
yeah,
so
surplus
again,
buildings, vacant buildings that could be identified and made ready to receive patients.
So as Deputy Commissioner Martin mentioned, we have a regional healthcare preparedness coalition that has done extensive alternative care site planning, and so those supplies and plans are already in existence, and that's what we would kind of implement if necessary.
And does the health department manage in emergency situations community clinics and FQHCs and training and other staffing support?
We don't manage them, but we do have very close relationships with FQHCs and actually have already been hosting regular FQHC convenings. So we, in conjunction, our chief medical officer communicates very regularly with leadership at FQHCs to determine their level of preparedness and to support them with public health guidance as needed.
Any buildings in Baltimore?
Are any of the, when you're looking at surplus locations, is that a regional search, local search? Can you speak to that a little bit when we think about
that? I'm not sure of. I don't know if Deputy Commissioner Martin or Director McMillan knows.
So I can speak to We had meetings this week with the Department of General Services, looking at some of their facilities for multiple uses with regards to continuity of operations and supporting the Health Department's incident command. In addition, we had meetings with DGS about moving forward with providing more hand sanitizing and other things for city buildings. So we're in contact with them about those city facilities, but I can't speak to anything outside of city-owned facilities.
So did he say yes? We got some capacity? Okay.
Good evening. I'm Kim Eshelman. I'm the director of the Office of Public Health Preparedness and Response for the City Health Department, and as a member of the Regional Healthcare Coalition in the Baltimore metro area. So that regional planning is really where our focus is, because we know when our hospitals are overwhelmed in the city, it's really a regional overwhelming that happens. So we work very closely throughout the region to identify different locations that could do this work. Additionally, though, if we're overwhelmed with our supplies locally, there are plans in place where we can, a resource management plan with those same regional partners to share resources and be able to respond as a region. And additionally, then there's processes in place that we'd work with the state and the federal government to request more resources as needed. So those processes and protocols have been outlined in our planning work that we do as a region and a state as well.
Councilmember Clark.
Every time I hear, that's a lot of times saying region. I'm really interested in Baltimore City. So, and I couldn't quite hear, I think the answer was we have some places in the city we've identified where we could create a place where people who are infected can be well cared for, but isolated from a general population of patients. So don't forget, we're the city.
Yes.
And when I say don't forget, it's just that we are forgotten when the word region comes into play. And I just want to make sure, because we're the ones that don't have cars and that don't have the red line and don't have really effective public transportation. So we're the ones that really need to have places right where we are and live. So it's very important that we know where we all have to go when the going is required, if it is.
Yeah, so to further explain, I think I'd add on that it depends on the size of what's needed. So the individual hospitals, we also work in the city with our hospitals to make sure they can surge their capacity within their facility and even expand that outside. And so it's really when those resources even get overwhelmed that we expand our response.
And I understand that, and I presume you're doing that, but I also understand that you can't just put people in beds mixed with the general population, of course. So that's like a wing or something in some hospital. I don't mean to be, I think you guys are just great. I really do. I know you got it together. I just waiting for the calls. And I need to know the answers that I think I have to know. So basically, just remember that, please. And I know you're doing a great job. And just don't wait till the last minute, because God, we may be blessed. We may be blessed, and this is all not needed. But we have to be ready. And we'll need space.
Yep.
Thank you.
Yep.
So on that sort of line of questioning, my understanding is that there's a strategic national stockpile plan for resources, supplies. Has BCHD worked through how they're going to accept supplies, materials, countermeasures, and where those materials will be stored and distributed? Well, we don't need to necessarily know where, but do you have locations as to where these things could be stored? And then the other question, maybe again a finance question, but are there emergency procurement and contract service agreements already in place?
So I'll speak broadly to the first question and then turn it over to Director Eshelman. So we have very specific plans as a part of the grant funding we receive for bioterrorism, and then I'll turn it over to Director Eshelman to go into a bit more detail.
Sure. So the city receives a grant called the City Readiness Initiative that funds this public health preparedness work that we've been doing for over a decade now. And so we do have our protocols in place for how we'd request additional resources. The process is basically, it goes from the local level to the state level, through the governor's office up to the federal government. And when those resources are received, they would come first to the state, and then the state would be distributing out to the local jurisdictions. Here in Baltimore City, we've tested our plan annually for how we would receive those and distribute those out. And then there's also the avenues of if a vaccine were to come, which at this time there is no vaccine available for COVID-19, but if that changes, we would be able to use that system also to get vaccine out to the community as well.
And there was the finance question, which I don't know if we have.
It's coming, yeah. Can you speak to emergency procurement and contract service agreements that are in place in the incidents that there may be a need to order things quickly in large amounts under emergency situation?
Sure. So the Director of Finance has the authority to designate emergency procurements of anything above $25,000. Historically, we have not been shy about doing this. So we are definitely, I want to make clear that from my office in the Department of Finance, we are first concerned about responding to the emergency and then accounting for it after the fact. But there are POs set up with all of the vendors where we would need to get necessary supplies. For anything specialized, they would have the ability to do emergency procurements.
Thank you. Council President Scott.
Thank you. Madam Commissioner, thinking about, for example, like public meetings that happen here in City Hall and the ones that the agencies would have out in communities and things like that, do you have ideas about how folks like yourself and my staff and liquor board, zoning, could communicate about those things and figuring out how we would move with those processes? Or is that something that you could share today or you want to talk more about offline?
Yeah, I think we can definitely talk about it more online. As I mentioned a bit in the presentation, it will be on a case-by-case basis based on the transmission of COVID across Maryland, as well as guidance from the Centers for Disease Control and Prevention. So I think certainly it's something that we can have ongoing discussions about if that concern arises.
Thank you.
All right. Thank you, Commissioner DeRosas. I guess if there's other questions, your staff will be here. You'll be here for the remainder of the hearing. Okay. So we do have presentation or discussion from OEM.
I can give you a brief update.
That works.
Good evening. David McMillan, Director for the Mayor's Office of Emergency Management. So MOAM has been in coordination since mid-January with a number of agencies, primarily the Baltimore City Health Department, but also the Baltimore City Fire Department, the 911 call center, DGS and facilities, various city agencies. At the state level, we've been in contact with the Maryland Emergency Management Agency, working with them and having regular conference calls with the regional and statewide emergency managers. We've also been in contact with the United States Coast Guard to review their procedures for maritime security related to COVID-19. The situation is evolving, but we've moved to watch level 3 for the Emergency Operations Center, which is currently right now remote coordination, and citywide conference calls will be ongoing, both about joint information, but also continuity of operations. We have regional, state coordination going on between the emergency managers, the hospitals, MIMS, and various entities. We'll be implementing these ongoing calls to make sure that we have effective coordination around maintaining city services. So our biggest concern moving forward will be, if it happens, eventual loss of personnel in the city, perhaps loss of facilities if we see facilities that could be making employees sick. So we'll be working at managing those issues, looking at really telecommuting as a primary tool here to ensure continuity of operations for functions that aren't forward-facing in the public. Also making sure that we have that clear designation between essential and non-essential personnel. Fire department and police department have great policies and procedures in place to ensure that people come to work, and we'll be ensuring that happens with all the other civilian agencies. And really moving forward, our major concern is to partner with all the agencies effectively, as well as our local, regional, state, and the federal government to ensure effective operations and coordination around maintaining basically city services. So right now, things are in a steady state. We've moved to level 3 to ensure proper coordination and the correct conversations are happening. And we will be looking at leading indicators and various trigger points to make any further decisions on further escalations of operations.
And is there, can you describe the incident command structure that's in place and sort of how that information flows between agency? Who's in
So
charge?
right now, the health department is in their own incident command, which is at level 2, where they're reviewing and revising their plans. In terms of the city emergency operations center, again, we're at level 3. Health department is the lead agency for, basically this is emergency support function 8 within the emergency operations plan, which is health and medical mass care. So they're the lead agency. OEM's job is to bridge the gap in terms of any unmet needs and also making sure we have effective coordination. So they're the lead agency. We're at that level 3. There could be an escalation to level 2 or 1, depending on, again, various trigger points and the leading indicators that we'll be monitoring as a city. But again, we want to right-size our approach, and we want to make sure that we ensure continuity of operations in the most effective way possible.
Council President Scott, then Councilmember Clark.
Thank you for that, Mr. Director. And then also, could you talk about in the event, and we know that the health department and the great work that they do, in the event that things do happen, for example, let's say if it's at a school, how will OEM be involved, and what kind of role will you be taking as the emergency management agency to ensure that agencies like that are following the proper protocols, et cetera?
So 2 roles. One, we're going to be ensuring effective communication within the Joint Information System. So we already have a standard PIO group that meets on a monthly basis. We'll be escalating that communication with the health PIO as the lead, working on a weekly basis to push out communications. Then the second part of that, again, would be the continuity of operations part. In terms of incident command and the agency, again, health is the lead. We're there to support them for what they need in terms of community interface, unmet needs, and coordination within the agencies. So we've been having very close conversations. I've been talking with the health commissioner on almost a daily basis about ongoing issues and making sure that we have effective communications and operations.
Thank you. And just again, I talked with the administration about this, but then just ensuring that we have information so the council can get it out. So that's a great way for us to just stay involved and then stay ahead of the questions that my colleague, Councilman Clark, had brought up. Thank you so much.
Okay, thank you.
I'm good. I'm good. So you answered the questions. Thank you. You asked and you answered the questions. Are you going to have a center where you are if we really need to get active?
Yeah,
Is
so
there going to be like the blizzard room and all that kind
Right.
of stuff where the agencies are all in the same, their people are all in the same place physically?
Yes, so we have various locations where we can gather the agencies if we move to level 2 or to
Okay.
level 1.
And you know where, you got that under,
Yes, we do.
Okay.
And so we'll make those decisions when we see any trigger points or we see any
Okay.
escalation in terms of the indicators we're monitoring.
yeah, I mean, basically, at that point, people need to be in the same room.
Yes,
Yeah, thank you.
thank you.
Thank you.
I have a few questions for you. So the governor announced a $10 million, has announced $10 million for coronavirus planning. How much of those funds are coming to Baltimore City? What is the breakdown in funds for public health, fire, EMS, emergency management, BCPS, BPD, BDOT, down the list?
So I was just on a statewide emergency managers conference call today. They haven't given us the breakdown yet of how those $10 million of funds will be spent. But as soon as I would get that information, if there's a future hearing, then I would share that information.
Okay. Did they give a timeline on when you could expect that?
Not yet. So we're having more or less twice weekly right now calls. I expect that frequency will increase with all the appointed emergency managers for the jurisdictions. So we have constant communications. As soon as they get that breakdown, then I will relay that to the administration and to the council.
And is the allocation plan dictated by the state, or is that controlled locally?
I don't have the details on it yet, so I think once they give us the details, then I will relay that, and then we will go to bat for the city, certainly.
Okay. And do you have enough trained personnel and volunteers or emergency liaison officers from all agencies to respond to maintain a 24/7 EOC for weeks or months? And can you train them quickly enough if you don't?
The answer is yes to both. So currently, my staff is 12 members plus emergency specialists who work overtime for us. And then we have a very good group of basically city agency reps and liaisons that work with us during continuity of operations or incident command events. And I have 100% confidence that we'll have enough people to move forward. And again, we'll be working with the labor commissioner as well as DHR for the policies and procedures for any kind of emergency hiring or reallocation of personnel.
Thank you. Unless there were other questions for me? Okay. Thank you, sir.
Thank you.
We're going to now move to Baltimore City Public Schools. And I believe we have a presentation.
Yep.
Yep.
Oh. Oh, boy.
All right, good afternoon, Chairman Burnett, Council President Scott, and all the other committee members today. Thank you for giving us this opportunity to talk through the Baltimore City Public Schools Emergency Preparedness Plan for COVID-19. I'm going to go through...
Name, please.
Sorry. John Davis, I'm the Chief of Schools.
Is that a PDF? Yeah, you may need to scroll down with the mouse. It looks like a...
It's a PDF.
Yeah.
That still works.
There we go, 2020.
Again, I'm John Davis, I'm the Chief of Schools.
Oh, thank you.
And there are 4 tenants. This isn't going through this, so I'm going to start talking through it.
Yeah, just
Come on.
speak to us.
I'm going to go ahead and talk through 4 areas or 4 tenets of our emergency preparedness plan. The first is the collaboration with the Baltimore City Health Department. The second one is our internal and external communications plan. And then I'm going to talk through our increased cleaning in our schools, and then the contingency plans in case we have to close schools. For our collaboration with the health department. First of all, there's preventative measures and some very basic messaging. And speaking not just to the members in this hall, but also to anyone that is watching. The first thing is, if your child is sick and you're a parent, please keep your child at home. That is very basic messaging that we have to get out to everyone. And at the same time, we are telling our staff members, right? A lot of our staff members are incredibly dedicated. They come to work all the time as teachers and principals. But if you're sick as well, then you should stay at home. Yes, we need you available for our schools, but right now, under an abundance of caution, if you are sick, you need to stay at home. That's very important. And all of these messages have been in collaboration with our health department. The second one is around our screening protocols for students that are showing signs of symptoms. Specifically, when a child begins to be sick at school, we take them to the nurse's office, and if they have a fever of over 100.4 degrees, and at the same time they show symptoms such as coughing or shortness of breath, right, we're going to make sure that first we call the parent to pick them up regardless of any situation. So they've got a fever, they've got to go home. But we will also make sure that we start to talk to the child and then to the family to see if they've traveled recently and where they've gone. And at that point, if there is any type of situation where we think that there could be a virus that could be with the child, then we will call 911 and we will take them to the hospital very quickly, right? But again, that's after a standard protocol that we've worked in collaboration with the health department. It has to do with symptoms, it has to do with talking to the families, and then in the end, if we have to take action, then we will. But regardless, right, the parent has got to pick up their child, they've got a fever, they've got to stay at home. That's pretty standard, but right now it's even more important because there are just families at times that say, hey, I'm going to send my child to school because, you know, it's a normal school day, even if they're not feeling well. If they're not feeling well, they've got to stay home, and we just got to get that across in the strongest way possible. We're also working with the health department to ensure that we disseminate any guidance. The guidance I just spoke about went to schools earlier this week. We've sent out guidance to families as well. We've put guidance out for staff in all of our schools. So again, we want to disseminate all information to our staff, to our families, and make sure we're all on the same page. We also have an internal and an external communications plan, right? I just saw on our website, we've got a special area on our website where we are devoting space for COVID-19 updates. There'll be more updates tomorrow in earnest, but that is the first and easiest place because as Dr. Duraza said, this is an ever-changing situation, and so we're going to use our website and update it very often to make sure that we get that across. Additionally, there'll be two-way communication through that. So if parents or community members have questions to us, they can get a hold of us, they can write their questions, and we'll respond to them, just so that we are answering any and all questions. At the same time, we've got an emergency communication plan where internal folks are on call so that as updates are coming, we'll end up getting the information out, right? Again, we've got people on call, we've got close communication with the health department, so if there are cases that spring up, then we'll figure out what to do on a case-by-case basis. We'll also have an emergency call center. I think Mary Pat, you mentioned like to the Office of the Mayor's office to have that type of thing. We're going to have that as well in city schools so that if there are questions that arise, we'll be able to have a group of people that can answer it. Let's go to the next slide. School cleanliness. We're sending out communication to custodians to up their cleanliness routines, right? They've got a routine that they have to do every day, but we're upping that especially in the areas that are major touch points, right? Restrooms, cafeterias, if there are communal spaces. In some of our new 21st century schools, there's areas where students go and work maybe in kind of a community area. And all of those types of areas, we're going to do more cleaning and even try to double it throughout the day just to make sure that we're hitting as much as we possibly can. Additionally, we're ensuring that we're stocking everything up with soap and making sure that we've got all the supplies on hand as well. I've got people in my office going out to schools checking on that, and we're going to continue to do that. Additionally, we've got an emergency deep cleaning plan, right? In case we have to close a school, we are getting some of our best custodians together, giving them training over this next week. And if we end up having to, hopefully this doesn't happen, but we're trying to think in advance, if we have to deploy them to a school that has closed so that we can do deep cleaning in a really quick way, we're going to do that. We're going to get our best custodians in that effort and really make sure that we can hit a school if we need to. Let's go to the next slide. And then again, similar to what we would do with those custodians, there's additional school closure routines that we're thinking about, right? And I shouldn't say thinking about. We will house instructional activities on the website so that if we do have to close a school, parents can go to the website. Let's say it's a high school, then there'll be 9th grade through 12th grade assignments there that parents can get for their students. And the children can continue to get some type of academic nourishment, even if they have to stay home for a week or two, depending on how long this is. And again, we don't know how long this type of situation will last, but we're just trying to put this stuff in place. We'll work closely with schools. If a school has to close, maybe the teachers can put that in. But if they can't put that in for some reason, we'll have people at central office that are social studies, science, literacy, and math experts that can put that stuff online so that we'll have additional academic resources. We'll have consistent communication that goes out through robocalls, through emails, so that if a school does have to close, we can give them updates on a daily basis. And then lastly, we'll work with the emergency food working groups so that if there are food situations that in our schools have to be used, we'll take that on a case-by-case basis. Right now, we already have 3 schools that have been designated as such, but we just don't know yet in a type of quarantine situation if that really will be the right thing to do or not. So again, right, it's all about collaboration with the health department, getting information from them because I know they know the latest from the CDC and the experts that are out there. Again, to kind of summarize this, I think that's about the last slide. Let's go to one more. Yes. To summarize this, right, number one, we have already been working closely for the last couple of weeks with our health department. We've sent stuff out to our schools. We've sent communications out about how to deal with students who have a fever, who might have a cough, and we'll continue to send out information because we know that communication is key in this area. In the background, we're setting up a lot of different plans so that if the school does close, what we need to do, both academically, but then also as far as cleaning the school and being really strong on the communications end so that everyone knows what the situation is.
Okay, thank you. Council President Scott.
Thank you, and thank you, Chief Davis. Thank you for all your great work and your commitment to the young people and families of Baltimore. I want to go to a few of the things that you talked about. One, when you talk about if we have to close schools and having the information online, I think that's great, but my only concern about that is the amount of our young people who and families who do not have access to internet at home. And if their school is closed, chances are that their library, which is the other place they would go to have computer access, in the rec center will also be closed. Have you guys considered how we would then communicate that stuff? And I know this is going to sound crazy coming from a millennial, talking about mailing work or figuring out how to deliver work to the families at home, because we know in Baltimore City we cannot have our young people afford to lose any instructional time or any knowledge because they already are facing challenges that no other student has to face across the state. How are we going to deal with that divide, that digital divide, that access divide in a situation like this?
Right. We have thought through that. I don't know if mailing is the best idea, but that is something we can take back as a possibility. One idea that we've came up with is what is a local area to the school that will remain open that we could make copies of and just house there and then communicate out. If you need work, you go to X. It would be great if we cleaned the school and if in working with the health department, it was okay for families and students to come up and pick up work, that they could come up to the school, right? That would be our ideal situation because without a doubt, we have to do stuff in hand for students that don't have access, but then students have access on their mobile phone and in different areas. So we got to do both, right? And so yes, we have thought through that. We'll think through the mailing aspect as well, but there has to be hopefully some type of hard copy way that we can give them work as well.
And in the incident that let's just say a worst case scenario, a school has to be closed for a month. Have you guys communicated with the folks at the state level to see how they're going to deal with that as far as instruction time, as far as graduation, as far as testing, all of the things that we know that are literally about to happen right now across the state of Maryland?
So we haven't gotten word on those different scenarios from the Maryland State Department of Education. Those are going to be things that we have to think through if we do have a prolonged situation. But right now, I think we're thinking more about the preventative measures, more so than what happens if they do close. If a school does close, then you're right. All of the testing situations, the grading situations, students expect to graduate, there's going to be a lot of implications that we're going to have to think through, which makes it even more important that one way or another we get work to them so that in the end they can earn their degree, they can be ready for a test if they have to come back and take the Maryland State tests. So yes, all of that is going to have to be thought through.
Because what I'm thinking about is like those young people that are seniors in high school or eighth graders trying to go to a certain high school next year. Because if you're a senior in high school and you miss and do these things that you have to complete in order to go to college, that doesn't just affect your graduation, it affects the rest of your life.
Yep.
And these kind of things I think have to be thought through and considered. And if you guys need help communicating and getting some answers from the state, please let us know, because we will reach out to our contacts and our fellow legislators there to try to push that envelope, because we know how great an impact that could have on young people in Baltimore.
That's right. When we have to make decisions like that, we're going to make them in the best interest of students. So if their grades are compromised in some way, we're going to figure out the right way to give them every opportunity. There's one other thing that I did not mention, but I feel like I should mention to everyone, and that is we are going to stop our international trips for the rest of the year, just out of an abundance of caution. I know of one trip that I recently looked at, and when I took a look at the city they were going to,
Yeah,
there's
I have
already
like 20 emails about it today.
Yeah,
Just
that's
happened
right.
to be Mervo, so my phone's been blowing up all day today.
But one of the cities they were going to has 6 confirmed cases, right? And it just is not responsible to send kids in situations like that, right? And at that, and I know one of the things that always brings up in those emails, and one of the situations that we'll have to figure out is what the reimbursement is on this, right? Sometimes these types of trips are through grants, and there isn't a lot of out-of-pocket expenses, and sometimes there are. And so we'll take it on a student-by-student, family-by-family situation and do everything we can for them. But I feel like I should say that because that's a decision we've made here just recently.
Thank you. I'm done for now, Mr. Chair.
Councilmember Slifer.
Yes, you had mentioned that there are 3 buildings in which you would use for schools to relocate to. What 3 buildings are those?
Sorry, that's, if I said that, I miscommunicated, right? There's 3 emergency feeding sites that we have, and I'm not sure if we would open those or not, if we did have widespread closure, because we would have to work with our health department. Is it a quarantine situation, or would it be okay to open those up? I was talking about that with respect to, I think there's a food and nutrition working group, and we're going to have to make a decision if we get to that point.
Okay, and where are those 3 locations?
One is at Dunbar, one is at Arlington, I believe, and the third one is escaping me right now.
Okay, thank you.
Sorry, can you repeat the locations again?
Yes, I should have had those. One is at Dunbar, I believe the second one is at Arlington, and I think the third one is Cherry Hill Elementary Middle School.
Okay. So we talked a lot about students and parents. Do you have the capability to have staff telework, both at headquarters and at any individual school? Are there plans coming together?
Right. At schools, I think it's a little tough, but if we did have to quarantine a situation, and if we did need to get work from them, then I think that would be the most ideal situation, right? It would be great if they just didn't get a generic biology assignment. It would be great if they got it from their teacher. So we'll work with schools that are closed, and if their teachers can supply that remotely, that would be great. If they can't, though, we want to have a fallback from our central office experts around science or literacy or whatever to create those types of assignments. So we do have that possibility, and we'll just have to take it and work with schools based on the teachers and what their access is.
Do you have a continuity of operations plan at BCPS?
I mean, I think the continuity of operations, you talking from a central office or a school-by-school basis?
Well, wherever you want to.
Well,
both.
I mean, a school-by-school basis is if we have to close a school, then we'll keep that school closed until working with the health department, we think that they're okay to open, right? From a central office standpoint, the continuity of operations really falls within our operations and our chief of staff. And I don't think I know enough details about that to speak honestly about it, but we would figure out how we would do that. So in the example that you gave about getting additional work, and we talked about teachers, we would do the same thing with our central office staff, right? If for some reason our central office staff can't come to work, but they can supply information and supply assignments remotely, then we'll do that.
Does your school nurse program have a temperature plan and an algorithm to raise alerts such as spikes and flu-like symptoms And is that information being reported out daily? If so.
Right. The main channel of communication is the nurses fall underneath the health department, and so they have supervisors there, and that's the main mode of conversation or the main mode of transmission. And we work closely with them, so if there is a spike or if there's something nurses are seeing, then we will be alerted to that as well. And to be honest, I personally and people on my team work closely with principals, and they're very attuned to this, right? All of the precautions and the procedures we're talking about if a student does begin to fall ill, the principals know this, and so it's not just the nurses, but it'll be the school administration that we work closely with. We're also going to start taking a look at our daily absences, right, to see if there's a spike through that as well.
Okay. And is there any additional perspective on the impact of school-age children that have asthma or other underlying illnesses? Is that kind of information monitored? Do you know who these students may be? Are there additional precautions that could be put in place for them, particularly vulnerable?
I mean, to be honest, we're not putting additional precautions unless a child begins to show symptoms, right? What I also just want to be very clear about is if a child shows symptoms, then we got to help that child and do everything we can. But at the same time, I don't want us to exaggerate situations and kind of label kids because of this or that. And sometimes that can happen in these types of emergency situations, right? Kids right now are coming into school to learn, and we got to keep it on that. But if they start showing those symptoms, then we put our procedures in place. We were going to get a hold of the parent. That's why I keep saying, families, if your child is sick, keep them at home. And it'll be the same thing if they fall sick in school.
Okay. Okay, thank you.
All right, thank you.
All right, next, a presentation from the fire department, fire EMS.
Good evening. Timothy Cullen, Captain of Fire Department Infection Control. I'd like to give you an overview of what the fire department's doing, specifically from me on more of a daily basis, and then I'll pass it off to Chief Matz. We're actively monitoring this situation. We're performing daily surveillance, keeping up to date with the latest information through CDC, World Health Organization, city and state, local agencies, through Johns Hopkins has a surveillance tool. We're collaborating with other city agencies, city and state, local hospitals, other jurisdictions. We have frequent meetings. We're in contact with emails, phone conversations, emergency management, our 911 center, and of course the health department. We're actively publishing informational directives, guidelines, safety messages for each of our shifts, updated information as it becomes available. We're ensuring that our personnel, and especially our command staff, is provided with the most up-to-date information. We as EMS providers, we're following the guidance of MIMS, our state governing agency, which is based on current CDC recommendations. Some of those are pertaining to personal protective equipment that we use, person under investigation criteria for identifying these patients, screening calls through 911, hospital transportation and alerting procedures. Our units, if we identified a patient, we would alert the hospital before we come in over the air so that they can prepare for us, so we're not just rolling a patient into the emergency room, waiting room. Also ambulance decontamination. We've also reached out to our occupational health provider, PSI, to request that they start planning in case it does hit locally, in case it does affect our workforce with quarantines, with sick personnel, call-out procedures. Make a quick note on training. Our members have extensive training in PPE, infection control, which we use on a daily basis. Not much changes with this. They're trained through EMS certification, new hire training, annual updates, hazmat training. And we're also working on developing up-to-date COVID-specific training programs. One of the things that I want to emphasize is what we're presented now doesn't change how we face our PPE. The major change is the heightened awareness for our providers to take advanced measures. Also, we started doing daily inventory assessments. We're looking for overutilization, some needs, some patterns. We also don't want to change the public's perception of us. We don't want our members coming out, showing up at every house in full PPE, only when that's indicated. As for our PPE stock, our frontline stock, everything that's recommended by the CDC, We've evaluated eye protection, N95 respiratory protection, which we are fit tested annually for and has to be cleared by a medical provider through PSI, fluid-resistant gowns, gloves, and we're also preparing for the reality that we may face some challenges with supply availability. But pass it off to Chief Matcher.
Hi, good evening, Chairman Burnett, Council President, as well as members of the Council. My name is James Matz. I'm the Acting Deputy Chief of EMS. I want to piggyback for a second on something that Captain Cullen was talking about with regard to PPE. A lot of people, including some agencies within the city, have been calling and asking us for masks. The main thing to remember here is we use special masks called N95 masks. OSHA mandates that we are fit tested annually on those. We actually go under a mask. When we treat patients like this, as we've done in the past, the patient that has the potential exposure wears just a surgical mask, and what that does is prevents their exhaled air from getting on us, and then we put one on ours. Those inventories we have to watch closely. Right now, those inventories, they're mostly sold out. We're trying to look around and see what's out there right now. So, what I wanted to talk on personally was talk about some more strategic type things that we're looking at. I know Captain Cohen had talked about us monitoring closely our federal, state, and local partners. The one thing that I want to point out to the council is that we have legacy with things of this nature. We've actually been there through SARS, through H1N1, MERS, and Ebola. I've personally worked very closely with OEM as well as Deputy Director Martin on several occasions, predominantly with H1N1. And the question is, what chapter of the book do we take out for this event? Right now, we're low in the book. If things get worse, we have to go a little deeper, and I was going to talk about a couple of those. I would like to reiterate a couple of things that the Commissioner as well as Director McMillan had talked about with regard to COOP and pandemic planning. It's critical that we do that. We have to start thinking about worst case scenarios, 40% of our workforce could potentially be off at the same time. That's a huge impact to us because with COOP plans, some of the plans they talk about is instead of having a face-to-face meeting, doing a conference call. Can you potentially telecommute from home? Fire and police don't have that luxury, so we have to think about different things outside the box. One of the things that Captain Cullen was talking about was public safety infirmary through Mercy. With H1N1, what we used as a trigger was one of our own members came down with H1N1. What we did is suspended our public safety infirmary policies because the last thing we would want was one of our members with potentially coronavirus going into Mercy and making everyone sick there. So I wanted to point that out. One of the other things that we're looking at right now is standing up our IMT, Incident Management Team, which is right now we're looking at standing up potentially the financial section as well as the planning section to see if things scale up where we would go from there. And the last thing I wanted to talk about briefly, we have a lot of experience with this. They always open up federal and state dollars with this. I would challenge everyone to start making timelines as well as tracking expenses because somewhere down the road we have a good chance of getting reimbursed for a lot of these expenses. And I think that's all I have. If there's any questions.
Looks like Finance would like to respond.
Yeah, we've already provided guidance to the agency CFOs. We created a tag within the city buy system, so we're able to very quickly be able to pull any POs that are directly related to the response. And also we created a template for agencies to be able to track staff time, which will be through David Shop at OEM, where we will get submissions. And my office will put all of that together at the end in coordination with the other response agencies and submit for reimbursement if it ever reaches that level. Just for context, we actually went back and looked at H1N1 and how much we spent directly on response, and it was somewhere around $80,000. If things kind of go the way we think as they are right now, we expect to see something around there. Anything more, we would just track very closely with the health department and our public safety agencies.
Just to follow up, Mr. Reynolds, as far as making sure that people have the equipment, you said earlier the emergency procurement practices in place and all that stuff has been relayed to all the appropriate agencies?
Yes.
Thank you. That's it.
Councilmember Clark.
Do you have test kits?
Not at this time.
When do you expect to, or do you ever?
We would never test something like that.
You would
that
never
would be
test?
up to the hospital or the local, primary care physician or clinic would be handling that. Fire department would never do that.
Okay. Thank you.
Okay. So I had a few other questions that you touched on a little bit, but just wanted you to expound upon, and just want to add context that the line of questioning is around if there was a large, if this is a scaled up incident, emergency situation in the city of Baltimore, not what are you doing right now. So one, you mentioned the staffing challenges. Are there cleaning plans for all in-service vehicles already in place?
Yes, the cleaning doesn't change at all. We still use the standard cleaning procedures, EPA wipes. What we have been working on also is if we do have a case that may need additional cleaning, we could pull in our hazmat units. Obviously, we don't want to pull in a hazmat unit for every cleaning, every case that we come into, but we are following the CDC guidelines on cleaning. So it's again, stuff that we do every day. It's more about the awareness for it, but yes.
And capacity to do widespread decontamination for staff?
I'm sorry.
Decontamination for staff. Do you have the capacity to do that at scale?
We do. As
you mentioned 40% as being the worst case scenario. Are you able to meet that as far as making sure that number doesn't go any higher? In the worst case scenario, you mentioned that.
Worst case scenario at this time, we're in good shape. The one thing we have to be concerned about, if you remember from Washington State where they had the deaths, they actually had 25 firemen were quarantined for 14 days that went to that nursing home. We have a finite amount of staff that can do that, so we have to be very careful. That's why we follow the particular PPE that we do, and it's very critical that we keep those stocks where we need to keep them.
PPD. What is PPD?
Personal protective equipment, those masks I was talking
Oh,
about.
PPE.
Yes, ma'am.
So what are you going to do? So all of a sudden there's a problem at a nursing home. Some people get sick. So the first thing that happens is that an engine goes and pulls up because, and then the medic unit will follow later, as soon as they can. So you have firefighters, and then you got medics coming along down the road. But sometimes the firefighters coming off the engine save lives right there, then and there. Everybody's trained. So are you going to go in?
Yes.
Okay, well, then what's the difference with what happened in Washington?
My guess is that if we were to go in, our members would go in with full PPE, so we would
Okay,
approach
you
the
mean
patient.
what you see on television?
No. The mask, spatial separation gloves. The PPE is different for this case than, say, Ebola. We're not talking about full Tyvek suits. So we would go in and approach you like we normally would, gather history, just maintain spatial separation, so maybe 6 feet distance. How are you feeling today? Well, I just traveled here. I have a cough, I have a fever, shortness of breath. Okay, man, we're going to, put on gloves, put on a mask, place a mask on you, and then we're going to care for you just as we would at any other time. That limits our exposure. Those are the guidelines that we will follow. So that's why I made the mention that I don't want our people, I would feel like I failed if our people showed up at every call.
I know it's scary, but you got to protect yourselves. You don't want to have 14 officers end up out of commission.
And that was probably because there was no early recognition,
Right, they just rushed
no
in.
training, so they probably just walked in, grabbed the patient.
Right,
and
but you're off. You all know what to do now.
we deal with that on a daily basis. Now, that's not to say that someone doesn't walk in and make a mistake, but
Sure.
everyone is trained with that. Everyone does that. Even if you had a common cold, this doesn't change if we came in and you had measles or chicken pox or something. It's still a droplet disease. If you had the flu, we would approach you in a similar fashion. Maybe not with the gowns, but.
And that's as of now. Things might change tomorrow. So we're following the lead of what they're telling us to do.
Just so there's a leader out there somewhere.
And our fire companies, they have this.
Governor? So locally, I got it, who everybody is. But
At the state level, the Maryland Department of Health, at the federal, would be the CDC would do the guidance, right? Okay. For what, our PPE, we follow from the Centers for Disease Control at the
CDC.
federal level.
Yeah,
The state
yeah,
would be the
well-
Maryland Department of Health, and then local would be there.
so yeah, I know we learned tonight who's who here.
Our firemen have the same equipment. I don't know if that's what you're asking. They're trained EMTs. They do have the same equipment as us, as the medics. Yes.
Okay.
And so on that, you mentioned, oh yeah, sorry, thank you. Sorry, I just jumped right in. So transportation protocols, can you speak to that a little bit? And if there is an unfortunate incident where someone is deceased from this disease, how does that change the way that you transport them from where they are? Yeah, can you speak to that a little bit, both for patients who may be alive and you're moving them out of, say, a nursing home or another facility, or if you, I don't think I guess you would, if someone was deceased, would be also moving them out, or is that not in your shop?
We on deceased patients, we contacted obviously the police department and the medical examiner's office, who arranged to remove the deceased. As for regular transport guidelines, the only difference is the alert that we would do to the hospitals. So through the state of Maryland, through our EMRC, when we call the hospital, we would just identify, I need a medical channel with such and such hospital. I have a PUI, a person under investigation. That alerts the state, that alerts the hospital, and then they switch us over. We talk to the hospital and say, we're coming in with this, we're presenting with this. But transport-wise, our members would wear the protective equipment. The patient would have the equipment on them. We would care for the patient as we normally would, and then transfer care. Does that touch on your question?
Yep, it does.
Yeah.
Okay. Any other questions?
I'm fine.
Okay, thank you.
Thank you.
Thank you.
Baltimore Police Department. Are you? That's how you walk in, but I was not sure if you had a presentation or not.
Good evening, Michelle Wurzberger, Director of Government Affairs for the Baltimore Police Department. I believe the Deputy Commissioner spoke very briefly earlier before I arrived. We have a new protocol that you all should have in your possession. You're looking at me like you don't. Okay, we will make sure that you get that. Baltimore Police Department has been coordinating with the Health Department and all of the other partner organizations here. We're poised to support them in their efforts and also make sure that our officers are safe and healthy.
So I did have a line of questioning around transport, crime scenes, that kind of thing. Are you able to answer that today?
No,
Okay.
no.
So what we'll do is we'll send these ahead of time for the follow-up hearing.
Perfect.
So that, yeah.
And we'll
I don't put you
answer
on the
them.
spot for a bunch of questions you may not be.
Thanks,
able
sir.
to. Thank you. All right. Was there anyone else from that needed to speak from the administration? I don't think so. Okay. All right. One, I just want to thank all of you. There has obviously been a tremendous amount of preparation on all agencies, so thank you for that hard work. We do have some folks signed up to testify, or at least they checked the box. So I do want to go to public testimony. We have Kevin Cleary.
Okay. Hi.
Welcome home, Mr. Cleary.
Good evening, thank you. My name is Kevin Cleary, and for those who don't know, I retired a little less than 2 years ago from the Office of Emergency Management. And even though I retired before you joined us, Madam Commissioner, you have a really crackerjack health department staff. So it's, as a city resident, I'm really happy that these folks are working with Team Baltimore to keep us safe. When I was in OEM and in the snow room, and Mary Pat Clark would come visit us to make sure her people were looked after, one of the things that I looked after was what we call the critical infrastructure, making sure that EMS, fire, police could do their job. Health department was connecting with the hospitals, dialysis centers. But one thing that was clearly in the hands of the city was water and sewage. And so you referred to, Councilwoman Clark, some of the folks like me, seniors, who will be sort of self-quarantining to stay out of the germ mix. I need to make sure that if I'm in my unit, I can still get water from my tap, I can still flush my toilet. So I guess I would say to the administration, are you cross-training? How automated is our water filtration system and our sewer systems? Are you cross-training a cadre of other people? If this is a pandemic, there may be, all the good folks that work there now may come down sick. So are there other people who could step in to make sure that we get water and that I can still flush my toilet? And just on a historical note, in 1918, my grandfather's first wife died from the flu. His second wife, who was my grandmother, fortunately, she was sick but recovered, which is why I'm here today. So I'm really hoping that my grandfather's first wife is the last family member who dies in a pandemic, thanks to all your good work. That's all.
Thank you.
Well, thank goodness, and here you are to praise the Lord.
I think that's a valid question. Can we respond to that?
So we don't have DPW here today, and I imagine we can involve them in the next hearing.
Yeah.
We've had discussions with them about continuity of operations and making sure that obviously water provision and sewage is not affected by this. I can't talk to the public health perspective, but we're not, I think, worried about that as a possible service interruption yet. But I think next hearing will.
Yeah, next hearing, we'll make sure DPW gets the invite to talk about that. I think it's a very valid point. Thank you. I have Sharon Black signed up to testify.
That's a good point, man.
First of all, thank you. I was just mostly listening tonight,
Sure.
and it's very late, so I didn't want to present what I'd actually brought here.
If you want, you can give it to us in writing.
Yeah, I'm going to put it in writing. My name's Sharon Black with the People's Power Assembly, and we have a whole number of suggestions and questions that we wanted to present to the council, which we'll send by email. There will be a press conference of a number of community groups on Saturday at 12 noon in front of the city council here, which we invite council people to come and listen. I also wanted to personally thank Councilwoman Mary Pat Clark, who is also my council person, for her what I thought were very, very good questions. And thank all the people who presented here, the Baltimore City Health Department, Police Department, Fire, et cetera, which, I think deeply are trying their very best. I still think there's a lot that hasn't been answered, and the only thing that I thought was maybe missing tonight was any kind of presentation from the MTA. I know in some other countries where I've been studying it and looking at it, there have been questions of disinfecting and how they're going to deal with the transportation system in Baltimore City. That's a big, big question. So we certainly invite people to come and listen to our concerns as a community. And I got to commend Councilwoman Mary Pat Clark, because I was moved by what you were saying, because you have your pulse. I live in the same neighborhood of the actual real questions that people are going to be asking. And a lot of them haven't been completely asked here. And maybe, hopefully, the People's Power Assembly certainly wants to put itself on alert to be helpful to those seniors that you're talking about, especially with whatever students can do. So I want to just send you all our written testimony, suggestions, and comments, and questions.
Thank you.
Thank you. And as I said earlier, will not be the last hearing. So point taken. Last person, Bayane Zidibel. Sorry, I know I butchered that. Sorry.
My name is Bryn Zadibel.
I got that wrong. I'm so sorry.
Sorry about
That's okay. It's a hard one. This is my first time talking to you all, so hopefully this is the appropriate place to voice my concern. My main concern is that there's a lot of people that I know, a lot of citizens, who aren't going to go get tested or call their doctor, and that's because of the bill that not only comes from the emergency department, but if you call your primary care provider and you have to go talk to them, that bill comes back to you too. And I just urge everyone present who has any power to consider this, especially as you go forward. On March 18th, I unfortunately won't be able to go, but as you have a meeting about Medicare for all, and people avoid going to the doctor because of the price and the lack of the insurance coverage, especially in a certain bracket. I think it's somewhere between like 10 grand and 50 grand that are most at risk to be undercovered. And normally this just makes me angry and sad, but now it makes me scared. And so I just ask as a citizen that you consider this, as you move forward in all of your legislative decisions. I'm not really looking for an answer, more just trying to let you know that this is definitely on my mind. Thank you.
Yeah, we Medicare for All hearing is coming up. So as soon as you mentioned that was exactly what I was going to say.
Yeah, I look forward to seeing what happens there.
Yeah, I think that access to care is critical, and it's point taken.
Thank you so
and
much.
Like I said, we will continue these series of hearings. So any additional suggestions, questions, comments, please send it ahead of the next announced hearing so that we can make sure we're covering all additional bases. We did try and cover as much ground as we could tonight, but we did know that this would definitely need to be broken up into multiple pieces.
All right, thank you so much.
Okay.
Say one thing about
Sure.
Thank you. That's why I keep asking the same questions over and over again. It's not that I'm just asking them because I'm thinking them. Where do you go to know? Because that's what people will want to know, especially people with little kids, or grown people taking care of their grown elder mother or father, everybody. Well, I think this is a thing more like people aren't as worried about themselves as they are about the people they love or their next door neighbor who lives alone and is 90 in other words, everybody is thinking about the people around them more than about themselves and worrying about that, what to do. And I just think we just have to have we just have to know what to do and where to go about it. And everybody's trying to advise, and properly so. The last thing you want to do is go someplace where a lot of people are. Don't do that. But what do we do? How do we help the people around us? How do we help our constituents that are elderly? How do we help families with little kids that all of a sudden can't go to work unless somebody takes care of their kids? So these are the practical ones. But I think we have a great team, Mr. Chair, Mr. President.
Thank you.
I'm very relieved that at the local level, we have the A+ team.
The best team.
And all we say is, all you guys up there at higher levels of government, send the money, and we will spend it well and wisely for the people. Thank you.
She closed this out appropriately. Again, we will recess this hearing. The next hearing, we will likely focus on the questions that arose around infrastructure, emergency management, water supply, transportation. So those watching, if there was specific questions that you may have or on those topics, please let us know, and we'll be announcing a reconvening of this hearing very soon. With that, there's no other business. No one else has signed up, so we are now adjourned. Please make sure you look by your seats and don't leave anything behind. Thank you, and wash your hands.